Okay, welcome to Speaking Free. We're back with your hosts, Robert Budd. Good morning, Robert.
Good morning, everyone.
And Dr. Christopher Long from Family Residences and Essential Enterprises. Family Residences, for our listeners, I want to remind you that we are a multi-service organization founded in 1977 that supports approximately 4,000 people each year. Our mission is to ensure individuals of all abilities realize their full potential. And we are able to accomplish such a lofty mission through a wide range of different services that we provide, up to and including housing, recovery, transition to work, employment services, voc rehab, crisis, youth services, and integrated health. Family Residences is proud to feature a wide range of guest speakers through this radio show in an interest to engage our community in topics that are relevant to the health and human services field and relevant to the community at large. So we are very proud to introduce our topic today of direct support professionals in the workforce crisis that we face.
And we have a rather unique perspective on this particular topic because as a network, we actually touch the lives of almost 20,000 individuals. And so we have organizations that we are so proud to partner with who have a very interesting and unique reach within the communities that we're honored to serve.
We are happy to have a few guest speakers here that I'd like to introduce to you. John Drexelius from the Law Office of John Drexelius Jr. and the Be Fair to Direct Care Consultant. Welcome, John.
Welcome. Thank you.
Fred Catapano, the Manager of Recruiting for Free.
Good morning.
John Best, the Senior Vice President of Human Resources for Family Residences and Essential Enterprises. Welcome, John.
Thank you. Good morning.
Terrific. So this is obviously a topic that is near and dear to all of us, and we are really looking forward to speaking about this because the direct support professionals that we are privileged to work with every day are the backbone of what we do every day. So they are very worthy of further discussion and for us to come together as a community that cares to find ways not only to attract people to this industry, but also to retain them long-term to care for those that we're honored to support every day. So, John, maybe we could begin with you, John Drexelius, and you can share with us a bit about the role and responsibilities of the direct support professional.
Well, the DSPs are the men and women who carry out incredibly varied and important responsibilities to support New Yorkers with developmental disabilities and help them to live safe, fulfilling lives. They are highly trained in a wide range of critical areas that include administering medication, giving first aid and CPR, de-escalating dangerous situations, behavioral interventions, and providing safety for those who they support. They support individuals in the activities of daily living. They provide transportation. They teach personal care skills. They support the delivery of physical and behavioral health. And really, they form really trusted relationships with the individuals with disabilities and the families that they serve. They also must comply with OSHA requirements, fire drills, emergency evacuation procedures, on-the-job core competency requirements. They must understand and communicate complex information to others via daily logs, progress reports, and electronic means. As you can see, it's an incredibly important, demanding job.
Why is it that it is so difficult to recruit DSPs?
Well, the problem with the recruitment of DSPs comes right down to the fact that we're asking these men and women to do an incredibly demanding and difficult job, and we're only paying them an average hourly wage between $11.10 an hour and $14.60 an hour, depending on where you are in the state of New York. They are just totally underpaid, and it is really causing a crisis for our industry.
So talk to us a little bit about the turnover rates in the direct support professional role.
Well, the issue is that in 2018, the direct support staff vacancy rate throughout the developmental disability field in New York grew on the average of 14.3%, with many provider organizations facing even more dire situations. Staff organizations in organizations that have state-mandated minimum staffing requirements force these organizations to pay more than 12 million hours of overtime to direct support professions, an increase of 17% from 2017. Many direct support professionals get burned out and leave the jobs. As a result, we're faced with provider organizations are experiencing an average 26.4% direct support staff turnover. It just is, it's a true crisis.
And the overtime doesn't only create financial problems, but because it's such a demanding job, I'd have to assume that many people are exhausted with the responsibility.
Absolutely. And many times because this pay is so low, they're often forced to work double shifts and not have any real quality time with their family, with their husband, with their wife, with their children.
So a lot of organizations, I assume, are experiencing tremendous vacancy rates as well, because I know that's true of our organization. But from a statewide perspective, I assume that all organizations are in a similar position?
Yes, they are. As I said, it's an average of it grew by an average of 14%, and the vacancy rate for all DSPs is up an increase of 80% since 2014. When the vacancy rate was only 8%, it's now up to 14.3%.
Other than money, are there other obstacles to recruiting DSPs?
Well, a Metascad did a national survey of DSPs, and the overwhelming number one answer, 88%, was adequate pay and benefits. But they also identified insufficient training and guidance, the difficulties and stress of the work performed, and finally the lack of supervisory support and appreciation.
So why don't you talk to us a little bit about what we're doing in terms of advocating for additional dollars to the to our governor and the New York State budget, and those that are able to advocate on our behalf. What is it that we're doing to hopefully be able to elevate the salaries?
Well, we a few years ago, about the same time that the state of New York moved to increase the minimum wage to $15 an hour over a 5-year period, we recognized that the DSPs were going to get caught in a crunch because these are incredibly difficult jobs, and if you could make minimum wage and by flipping hamburgers or working at Target or Costco's or one of the other stores, it's a much easier job, and we were seeing the loss. So a number of associations, I think as many as 12, came together and began to coalesce behind a campaign that we called the Be Fair to Direct Care campaign. And we proposed that over 6 years, we would like to see the wages of DSPs in the developmental disability field increase so that the average wage of DSPs will be $17.72 in the downstate New York City, Long Island region, and $15.54 in other parts of the state. We were successful 2 years ago in getting the first two phases of that funded. The governor and the legislature agreed to fund that in the 2018 budget and the 2019 budget, we're just finishing now. Unfortunately, the 2020 budget doesn't include any funding for phases 3 or 4, and we propose, similar to the way the first two phases were funded, that we fund the third phase fully in year 2020, which is the upcoming budget year, and begin to fund the fourth phase beginning January 1st, 2020, and then continuing into the 21 budget cycle. It would be a total cost to the state of New York of $75 million.
$75 million for this upcoming budget year?
That's correct.
Terrific.
And in the context of a $175 billion budget, it's almost a rounding error.
Does the Be Fair to Direct Care campaign also address, if we elevate the base salary for direct support professionals, does it also address proportional increases for those direct support professionals that have remained in the field?
We've tried to focus on the folks who are closest to the minimum wage, but obviously there's an effort to do that. In addition, I think all of the associations are also working with a broader coalition of human resource providers to support the Medicaid trend and the Human Services COLA, which this year would provide a 2.9% increase, which would clearly allow us to pay our more senior staff, and when I say senior staff, I'm really talking about the house managers, the people who direct the programming, the nurses, and the other more highly paid staff who aren't on the front lines, who are on the front lines, but not necessarily at the lowest wage jobs.
We thank you, John, for your diligent advocacy efforts, and we're going to transition over to Robert.
So, John, just wanted to emphasize something you said. This is not just a New York State problem. You referenced Metasced and their national survey. So could you just highlight for our audience that this is not a New York State specific issue?
It is not a New York State specific issue. It's an issue around the country. I was just looking at the DSP crisis in Washington State, and it was shockingly how similar the concerns are and the challenges that folks in Washington State are facing to New York. And I can tell you that there are many other states in the same situation: Illinois, Wisconsin, Texas. The list goes on.
Mm-hmm.
That's great. So this is really a systems issue that really has to be addressed by our decision makers.
Absolutely. Well, we're excited to be joined by two of our colleagues, Fred Catapano and John Best, who are going to share with us some of what Free is doing internally. So, Fred, let's begin with you.
Mm-hmm. Morning.
What are some of Free's current recruiting efforts? What do they look like for our DSPs?
So we recruit in a variety of different ways. Some of the more popular ways that we recruit, job boards, open houses, job fairs. We post positions on Indeed, Glassdoor, Career Builder, Hire, Idealist, to name a few. We're also very involved with colleges and high schools. So with colleges, we'll attend college fairs, we'll post on their career sites, we'll do on-site recruitment where we're setting up a table in one of their high-traffic areas, trying to speak about the opportunities that we have and introduce them to the field itself.
Are there any specific recruiting efforts that are more successful than others?
So we have tried a few different or innovative ways to recruit. We had a carrier card campaign, which we tried about 6 months ago, and what we did is we created little referral cards and we handed them out to employees and out in the community or out with our guys. If they found or got in contact with somebody that they thought would be really good for our field or would be really good with the population that we serve, we would hand them out a card. And if that person who received the card was hired, the employee that did the referring got a bonus. So that proved to be successful.
So you're incentivizing your current employee base that refers other people.
Yes.
Terrific.
Yep. So that was good. We also had a community outreach initiative where we were canvassing local towns and kind of speaking about the agency and what we do and trying to just build awareness.
How do you advertise the open houses?
So we will either advertise on job boards, we will advertise in papers, we will hand out flyers, just word of mouth, talking about it, and we use Indeed a lot for a lot of that. That's our primary source.
I think it's a great strategy that we are immersing ourselves in the high schools. You want to talk a little bit about some of the work we're doing with secondary ed environments?
Yes, so we are very involved with Wyandanch High School. We started a program with them where it's an after-school program, so it's open to all students, and it's about 3 months long, and we give the students an introduction to the field. We kind of explain what it's like to be a DSP. We explain some of the advantages that they could take with them throughout their career as a DSP, and then at the end of the program, we give them a CPR and first aid training, so they're certified. So at the end of the training, not only can they take those certifications with them into the field, but they take them with them wherever they go. And at the end of the program, we hope to offer these students a job, employment with us, a summer job. So it's a win-win. So we're hoping that works.
We see it as such a opportunity to get into the high schools across Long Island in an effort to just educate people that Health and Human Services is a potential career path.
Yes.
So without us immersing ourselves, how would they otherwise learn of these opportunities that exist?
Yeah, they really, a lot of the students that we work with, they don't really know that it could be a career. And if they're looking to become a nurse, or if they're looking to become a psychologist, or if they're looking to become a teacher, these basic skills that they learn as a DSP will give them a head start against other people in the professionals in their career.
And the direct support professional role really does help to lay the foundation for people to develop a path of their own.
Sure.
And within Free, there are career opportunities that are made available to direct support professionals.
Many, yes, many. I could speak for myself. I started as a direct care worker and grew with Free, and now I am the recruiting manager, so it's great.
I have a similar journey. I began as a direct support professional as well, as did Robert.
As did I. And Fred, your passion for who we serve comes across so beautifully. So I think that's one of the reasons that people are truly just drawn to it.
Thank you. Thank you.
Are the job fairs successful? Before we move on to John Best, are the job fairs successful overall?
So overall, it depends on how you would define success. We usually get anywhere from 15 to 20 people that attend. And out of those 15 to 20 people that attend, we are able to move forward or progress with maybe half of them, a little more than half, that we feel would be success in the field. So, yes, it helps us get the word out and helps us bring in people.
And is social media a potential platform for us to recruit?
Yeah, we have been exploring different ways to take advantage of social media. What's great about social media is we can reach thousands of people. It's what do we do after we reach them? How do we engage them? How do we get them to come to us and want to learn about us? So we are exploring how to really take advantage of that.
It's also a wonderful opportunity for people of all walks of life. So I know we focused on high school and colleges, but also we have many people who are returning to or wanting to redefine their work life.
Yes.
We have people who have I love when people describe, well, I went and made a lot of money, but now I want to do something I love.
Yeah. And they make some of the best direct support professionals because the passion that they have for what they want to do and what they're doing.
Terrific. Thanks a lot, Fred.
You're welcome.
Now, attracting our potential candidates to the role is one aspect of it, but retention is critically important and just as important as the recruiting aspect. So, John Best, maybe you could just talk a little bit about some of the ways that Free is making efforts to incentivize staff to remain within the Free network.
Sure. So, we start by really trying to show our DSPs that this is a profession and that it is a place to build a career. At Free, we are very focused on learning and educational opportunities. So we have a very robust learning management system called Relias. It's a web-based system, and so all staff can access it from any computer at any time of the day or night and take additional courses that are of interest to them and that will support the work that they do. We've also used the learning management system to develop our own in-house certification program for DSPs where they can take a series of 8 to 10 courses. They receive a certificate and they are qualified to receive a pay raise. We also are part of a statewide program called the Alliance Program, which works in conjunction with the community colleges. And it provides state-recognized DSP certification. So we have students at both Nassau and Suffolk Community College who are getting college credit, taking college credit classes, and then they are getting this certification, which is something they can carry with them as part of their career credentials. We are now looking at ways to bring undergraduate courses into Free. 3 years ago, we started a very successful master's program and with Stony Brook University. And this spring, we will be graduating our first 2 cohorts, 22 employees who have been taking classes at Free 1 night a week for the past 3 years. Will be getting masters in either human services or human resources. And of those 22, 5 are DSPs. So, that's exciting that we're able to provide an affordable, convenient opportunity for them to get a master's degree. We've also done quite a bit of work with training and supporting our supervisors, since that supervisor staff member relationship is critical to retention. So we are really working to find ways to support them, to allow them to find ways to connect in their busy days and with their loaded workloads, to try to find ways to really make some time to build those relationships.
Terrific. Now, how do we educate people about these potential incentives to attract them to the organization and to retain them? Do we inform them at the time of hire, at the job fairs? I'm assuming all of the above.
Yeah, all of the above. I mean, we have, we do, of course, rely on our intranet. We start at orientation, promoting all of the learning opportunities, and we are about to open a new training facility. So we are constantly emphasizing the importance of taking advantage of what we offer in terms of professional growth.
Terrific. And the master's program that you referenced in your presentation, if I may just congratulate Fred Catapano, who's with us today, who's also one of the graduates.
Yes, thank you. Thank you. Yeah, very exciting.
That's great. So, John, the perspective that you bring is a little different than like Fred grew up in our field. You come from a different industry. So do you find that the recruiting and retention practices are similar, or is there any uniqueness to our field?
The crisis that we face in our field, my newer field, is dramatically different. But I have built my career in social services, so it's always been a struggle. People doing very difficult work for way too little money.
So it's that universal theme that we were referring to before, right?
Yes.
It's not just specific to us. And I think that's important for our general audience members who may not be familiar with Human Services Challenge, that the way that we are authorized to provide services and very much constrains what we're able to do sometimes. As innovative and as creative as we can be, there are certain rules and limitations that we have to live by.
Absolutely.
One other thing I want to mention, and this I believe would be a great way to close the radio show, is that Robert had referenced earlier that this is not specific to the state of New York, but is a national crisis. So not only does Robert serve as CEO of Family Residences and Essential Enterprises, but also serves as the president of Anchor. And perhaps, Robert, you could just share with us a little bit about what Anchor is and the national trends relating to the workforce development crisis.
So Anchor is a wonderful organization that provides supports and services for organizations that do the wonderful work that the Free Network does. And so as a national organization, we're able to look at informing people who are the decision makers and where legislation gets written, which of course legislation leads to regulation. And that all begins with policy and advocacy. So it's a multiple pronged approach that we want to make sure that people are aware of who we support first and foremost, because that drives so many of the value-based decisions that make it a necessity to have the flexibility and the innovation that we require in order to have the highest level of individuals supporting those we're honored to provide services to every day. Without that, it really becomes a rather mute exercise, because that's what we're all existing for, whether you're the president and CEO, whether you're a brand new DSP part-time, we're all here to serve individuals who are differently able to have the ability to be able to realize their potential. And that is a magical formula. So as a national organization, we see this universal trend that when we come to this in a value-based manner, honoring the principles of good support and service, that there's a magic that gets created literally on a daily basis. And so we find that part of the challenge for us is to be able to communicate this wonderful, wonderful experience to people who are very unaware that one of the most rewarding positions that they could ever have in their careers is that of a direct support professional. So we have been looking to do this national awareness campaign, and we will highlight that in a future show where we're talking about our Included, Supported, Empowered campaign, capturing the magic that gets created by our wonderful direct support professionals, clinicians, and in particular frontline supervisors who are supporting people daily. And we have truly brilliant stories that inspire and innovate the process that allows us as individuals within the field, some of us for a few decades, to stay inspired and to be inspired to greater creativity and opportunity. And that, I think, ultimately becomes the win-win with our community partners, including local businesses, family members, and people's circles of support.
Well, it's great to have the supportive anchor on the national level, but I would have to assume, because I know we only have a few minutes, but I would have to assume that when we were speaking earlier of the turnover rates and vacancy percentages in New York, some of the other states across the country must have an even more serious crisis.
So the stats, so there's some universal trends that we all share, and that is a kind of a universal pain point, if you will, just because of the way we're structured and the way we're funded. Then there are unique challenges to different geographies. That exists within New York State itself. Something that we didn't really cover is, in the downstate region, we're usually able to get to our desired place of work, whereas upstate you might have to travel an hour and a half, 2 hours with no public transportation. So New York State probably has one of the more varied geographies, but across the nation, each state has its own unique challenges. And often the way that the waivers that provide service allotment, if you will, to allow people to come into our field and be supported are very varied and differing. So we, as a New York State provider, have a great deal of ability to have a very wide and deep breadth of service, whereas some states are very limited. And the more limited you are, obviously, the more limited often your creativity is. So what we experience, and I do find that that's where the national perspective can be essential to our success, is to be able to realize just how much we do have, because it's so easy to focus on what you don't have. So the national perspective helps us regionally, but it also connects us to that larger system issue that we have to address, and that's really one of Anchor's big battles.
That's terrific. And there is from my perspective, no topic more important than direct support professional recruitment and retention. So we will certainly dedicate future shows to talk about perhaps some of the incentive strategies and what has been most effective, so we can share with our colleagues and come together regionally to create other opportunities to attract people to this great work that we have the privilege of doing every day. So we'd like to thank all of our guests for being a part of our show today.
Thank you for the magic that you guys create. It's wonderful.
Yes, thank you very much.
Thank you.
Thank you. We'd like to thank Long Island's K98.3 for their support in launching this show with us. We appreciate the collaboration.